name is Hideyuki Chiba from Omori Red Cross Hospital, Tokyo, Japan. It's our great pleasure to present briefly our study, endoscopic submucosal dissection of a large pedunculated polyp with wide stalks, a retrospective multicenter study. Most pedunculated polyps are removed by snare polypectomy. However, a large pedunculated polyp, especially one with a wide stalk, is difficult to remove and block safely by snaring because of the poor visualization of the stalk or the technical difficulty in snaring, sometimes impossibility, or the high possibility of the spotted bleeding. Thus, removing large pedunculated polyps poses great challenges for endoscopists. In contrast, ESD allows the direct visualization with the cutting line with some submucosal layer, make it possible to control any bleeding. However, we have seen no reports covering indications of ESD for such regions, so we examined the feasibility of ESD for large pedunculated polyp with wide stalk. Our study reviewed the 29 patients who underwent ESD for a large pedunculated polyp as the size is more than 3 cm with the poor visualization of the stalk or the technical difficulty in the snare positioning as an alternative endoscopic option of EMR polypectomy. From the results in this study, I would like to say 2 important points. One point is the ESD for such regions is feasible. Envelope resection was achieved in 28 patients of 29 polyps, and the curative resection rate was 86%, and moreover, there were no severe complications such as delayed perforation or delayed bleeding. Another point is we have to recognize the difficulty of ESD for such regions, mainly because of fibrosis. Fibrosis was present in 16 patients, and 9 were mild and 7 were severe. Interestingly, the stalks of regions with severe fibrosis was significantly thicker than the stalks of regions with no or mild fibrosis. There was only one suspended case because of severe fibrosis accompanied by the muscle retracted thigh. From the point of the tips of procedure for such region, if you perform ESD without thinking about the exact strategy, the polyp during ESD will become very fluffy and movable and make the procedure difficult. So please check out the published demonstrative video file of the actual case. This strategy will be useful for all readers of the endoscopy journal. In conclusion, our study showed the feasibility of ESD for large pedunculated polyp, especially when conventional snaring technique is difficult or impossible. Our next step is we plan to a larger sample size prospective study comparing with conventional polypectomy or with ESDs treated by the other ESD devices. I'm so grateful to all co-authors, all investigators, and all endoscopy staff for their contributions of this publication of our study. Thank you so much.